Good afternoon and welcome to the LGBT Bereavement, Is There a Difference webinar. My name is Brandy Brooks, and aside from being the moderator this afternoon, I am a contract manager for the Massachusetts Department of Public Health Suicide Prevention Program, the sponsors of the webinar. Before I introduce our presenters, Lisa Krinsky and Beth, Prullage, I would like to go over a few housekeeping issues. First, should anyone experience any technical difficulties with either the audio or video for this webinar, please dial 1-800-843-9166. Again, that's 1-800-843-9166. And a Ready Talk representative will be more than happy to help. Second, all telephone lines are muted except mine, Lisa's, and Beth's. So please use the chat function located in the left corner to type in any questions you may have. Lisa, myself, and Beth will do our very best to answer as many questions as we go along and at the end of the webinar during the answer and question period. Also, ladies and gentlemen, please be mindful, if you want to see the slides for this webinar this afternoon, you have to go to www.readytalk.com and type in where it says join a meeting in the upper left corner. You type in the following passcode, 624-5494. Again, that is 624-5494. And it will send you to actually join this meeting so that you can see the slides. And if you have any questions, again, please use the chat function. Now that I've gotten that out of the way, let me introduce our presenters, Lisa Krinsky and Beth Prullage. Lisa Krinsky is a licensed independent clinical social worker and the director of the LGBT Aging Project. The LGBT Aging Project was founded in 2001 by a group of advocates from both the Aging Service Network and the LGBT community who recognize that lesbian, gay, bisexual, and transgender elders were invisible to mainstream elder service providers and that elder LGBTs are invisible within the LGBT community as well. Our second presenter this afternoon is Beth Prullage. Beth has a master's degree in social work, is a licensed independent clinical social worker, and an adjunct instructor at Smith College School of Social Work. So without further ado, I will now turn it over to Beth and Lisa. Beth and Lisa, are you there?
I'm here. Can you hear me? This is Beth Prullage.
I can hear you, Beth. Let me see if I can get Lisa on.
She is using her work line.
Okay, let me see if that is... Lisa, are you there? Okay. Well, Beth, let's get started, and then hopefully Lisa can join us.
Okay. And I just wanted to say I've logged off and on multiple times, and I'm still having difficulty seeing the slides. I have a please wait for the next meeting to begin screen.
You I'm sorry, you said you see a please wait for the next screen?
Meeting to begin. So it says please contact the conference organizer if your conference isn't started at the scheduled time, but please wait for the next meeting to begin in a sort of scrolling circle. So I have logged on as a participant as you have.
Okay, well, give me 1 second. I think we're having some technical difficulties here. Give me 1 second before we start.
Sure. Sorry for anyone else who's waiting.
Beth, now did it generate anything for you on your end?
No. Actually, I just reset it. It says join the meeting, and I am going to put in my name. Great. Thank you very much.
No problem. Okay, so we'll get started in a few seconds. I see Lisa's joined us as well, so we're now ready to get started.
Great.
Okay, so it looks like we were having a bit of technical difficulties this afternoon, but now we are all set and ready to begin here. So, Beth, you can take it away at any point.
Okay. I'm still waiting for data to transfer, but I can give a brief overview of our presentation for today. One of the things that we'll do is we'll begin the conference today by first, there's a brief survey that we ask the people who are participating to tell us a bit who you are, so we have a sense of how we might give the information to you in a way that will be most helpful. And then Lisa will begin and speak about the LGBT Aging Project of Massachusetts, a bit about what that agency does. Here's my slides. Good, so about also sort of the history of doing this grant. I'll talk about some of the particular risk factors in relation to bereavement for the LGBT community, focusing initially on elders, as they're a population who are most likely to experience loss, but then also talking about other folks within the LGBT community, and then specifically how we've come to, over the years of doing this grant, a bereavement curriculum and different kinds of interventions and ways of working with this community that we found to be most helpful. So I guess if we could begin by, there's a place that you could input information here on what field that you represent. So that would be useful for us to have a sense of who our audience is today. So it's here on slide 3. Thank you. I see that folks are inputting now as we speak. As that data comes in, I wonder if I could turn this over to Lisa Krinsky to talk a bit about the Aging Project.
Sure,
Lisa, are you on?
I am on. Can you hear me?
We can hear you.
Excellent. Good afternoon. Glad to be connected technologically to everybody. So I'll just give a little bit of history and background to how we got here to provide these LGBT bereavement groups. So The LGBT Aging Project was founded about 10 years ago, and our mission really is to make sure that lesbian, gay, bisexual, and transgender older adults get equal access to all the services and programs and resources that are out there and that are available to them. And we do that in a couple of ways. We do that through doing LGBT cultural competency training for elder service providers and anyone who comes in contact with older adults and caregivers. And we also do some community engagement, and one of the things that we like to do in addition to our training is to try and create some ways to bring LGBT folks together, and we do that with partnering with organizations that run community meal programs, and so there are now 7 LGBT-friendly community meal programs across the state. We run healthy aging programs for LGBT folks, and we have, for the past over a decade, run an LGBT caregiver support group. And those have been important ways to connect with LGBT older adults, with caregivers, with folks who are either growing older themselves or in the lives of those who are doing so. And one of the things that we found was that when we were doing these groups is we're always sort of paying attention to what needs are not being met yet and what issues are out there for folks. And particularly in relation to our caregiver support groups, we were seeing that folks who had been caregivers were moving on to becoming bereaved and were losing their care recipients, and then in a position where they really needed some support as they dealt with those losses. And many of those folks also have not only been older adults themselves, but they've also been sort of folks at midlife who may have been caring for an adult, for a parent or for an older adult in their lives. And so we connected with the folks at the Department of Public Health and with their suicide prevention program, because we were quite mindful that for many people who've had losses, that having a disenfranchised loss and not having an opportunity to relieve that can, in many ways, lead them to a suicidal position. And so as we were thinking about these bereavement groups, I did a presentation and was talking about the issues, and someone got up and spoke and said, you know, I was looking for a bereavement group for a man who had lost his partner of 35 years. And when I called to make the referral, the bereavement group leader sort of hemmed and hawed, and then she said, well, you know, as long as he doesn't talk about the nature of his relationship, I guess he would be welcome in our bereavement group. And that absolutely shocked me, because you know, for an individual to be dealing with a significant loss of a long-term partner and a long-term relationship and then be told, you know, you can't talk about the nature of this relationship, A, defeated the purpose, and B, was not going to be a safe and welcoming place for somebody who was dealing with that level of grief in his life. And so on the one hand, I was really relieved that it was his social worker who had the door sort of shut in her face, and rather than this gentleman at this tremendously difficult time in his life. And so that prompted us to really pursue being able to offer LGBT bereavement groups for folks of all ages across the state, so that there are safe places where people can talk about these losses. And that was really a very powerful motivator, and we have found tremendous response in the bereavement groups that we offer. And one of the other things that are sort of related to this and people's sense of loss and concern is that just about a year ago, when there was a lot of public attention given to the rise in LGBT youth suicide and the issues around bullying and young people not feeling safe, there was a tremendous growth of an It Gets Better video campaign, where people who were adults were giving messages to youth and saying, it does get better, hang in there, and go forward in your lives. And one of the things that we noted at the Aging Project was that everyone who was delivering these It Gets Better videos, celebrities and run-of-the-mill folks, were adults, but nobody was over the age of in their 50s. And we thought that we had tremendous wisdom from the older adults that we work with that could really inspire young people. And so we created an It Gets Better video entitled Wisdom from Our Gay Elders. That was a tremendous hit on YouTube and got lots of viral play and reached the most frequently viewed lists. And so what we thought that we would do is just take this quick chance to have folks watch this and to see the It Gets Better video, and to also see some of the faces and hear the stories of LGBT older adults who have survived lots of many difficulties in their lives and wanted to sort of share this inspiration with younger folks. So, okay. Brandy, do you want to
Yes,
people?
So as we watch this video, please be mindful that you need to use your computer speakers, because I'm going to put the phone on mute so there's no feedback. So you need to turn up the speakers on your computers, okay? All right. So here we go. It gets better. Wisdom from our LGBT elders.
Hi, my name is Bob Linscott with Ethos and the LGBT Aging Project. I would like to share with you some voices that are so rarely heard but contain so much wisdom and a lifetime of experience. You know, one of the things that was really challenging for me when I came out was a certain myth that I kept hearing, that all gay people grow old, alone, lonely, and depressed. So naturally, if you've heard that same myth, your future is going to seem bleak or hopeless. But I would like to introduce to you a group of wonderful people who would like nothing better to do than to bust that myth.
Life does get better. And I know you may be looking at me with this gray hair and saying, what can he say to me? And what does he know about all of my struggles and problems? Well, the truth of the matter is, been there, done that, and here I am.
Listen to me. I'm old enough to be your grandmother, and look at me, I'm sitting here telling you, don't do it. Don't do it. It gets better. It does get better. You know what helps? A sense of humor. Have a sense of humor. Laugh about things.
So I just love being gay. It's not an issue for me. It's who I am. That is my whole core.
Look at me, 80 years old. It gets better with age. It gets more respect. It's funnier that I can laugh at some of the things that I've done. And my era was very difficult to be out, and yet I always found a laugh. I always found some humor.
Life is beautiful, and we're beautiful, and we are family. So don't give up. We're all here for you.
What you feel at 13 or 17 or 15 can be very different than what is going to ultimately happen to you. You're not going to be depressed. You're not going to grow up and be old and depressed and alone. That's not the way it is. That's the image that some people would like to project.
When I was 15 years old, I wanted to commit suicide, and I even tried it. And as I had the belt around my throat, I said, wait a minute, this is crazy, because I'm going to get out of here, things are going to get better, I'm going to make it, things are going to be all right, and besides, I couldn't hurt my family, I couldn't hurt my grandmother, and when I was 18, I left home, I joined the Army, and traveled all over, and in 1964 I met my partner. We've been together for 46 years, and I can only tell you that look what I would have missed if I had taken my own life. Not only would I have hurt my parents and my grandmother, I would have missed out on all of my life. Living with Lois for 46 years, all of the wonderful things that we've done, and I'm glad I didn't commit suicide.
I'm 66 years old, and I lived most of my life in the closet, and now, at my older age, I've come out, I've hung in there, and life gets better, and actually it's been even getting better for me now.
I know when I was a teenager 100 years ago, I thought about suicide, and I did more than just think about it. I attempted it. But I guess luckily I'm here, because after I got out of high school, all of a sudden I saw a whole new world. And when I got into college, I found that there were people who accepted me and me alone. And that was quite amazing.
I'm just happy to be this gay man that I am.
I'm a very happy woman. At 79.
I have more activities emotionally being out than I think ever before. So I have a very healthy libido.
Just put one foot in front of the other.
Watch Glee on television. They're all having a good time watching Glee.
It will get better. Take it from me, it will get better. It's guaranteed. I've been through hell and back a number of times, but I held on to who I am and my gay identity, and I love my sexuality. So whatever you do, please be kind to yourself and hold on. Just hold on no matter what. It will definitely get better.
Listen to me. It gets so much better.
It gets better. Hang in there. And it gets better. It gets better with age. Believe me. It is better. Yeah, it gets better.
So I hope everybody enjoyed that and got to see sort of the spirited energy of so many of our folks, really trying to inspire younger folks and older folks alike about what life is like as an LGBT older person. And now I think we're going to move on to Beth.
Okay. I just always enjoy seeing that video. One of the things I like about it is that, you know, one of the many things that I'll talk about today is sort of how, well, as we all know, elders are rendered invisible to some degree in our culture, but I think particularly subgroups of elders and LGBT elders in particular. You know, when I've had conversations with people about, you know, this is a group that I, you know, work with, LGBT elders, you know, even for people within the LGBT community, they even sort of, they don't necessarily always think about the generation or two that have come ahead of them, particularly maybe the younger that they are. And so, you know, one thing that I have found helpful, and I saw that a number of people work in senior centers or other places, is that, you know, this population can be among their age cohort and be quite invisible. Or you can think of, well, I don't know of anyone personally. But the numbers, you know, based on, you know, initially some estimates with Kinsey data or other things that talk about the frequency of people who identify as LGBT across, you know, across the age, you know, across all people. The numbers for elders currently would be between about 2 and 2.8 million elders are what is, you know, expected in this, and that I think is 65 and older in this country. And recent data, it's only been the last 2 years that on sort of statewide data or national survey data, people asked about sexual orientation. And initially, you know, those numbers have really held up. And when I think you still that's sort of an abstract number to me in thinking about between 2 and 3 million people roughly. But in 2004, there were 1.6 million elders in nursing homes. And so I sort of feel like that's a helpful number for me, because when I think about an elder population, I can clearly envision, you know, a segment of the population, or that's a familiar type of idea for me to have an elder maybe be in an assisted care or assisted living facility. And think that out of all the people nationwide, there's even far more than that who identify as LGBT and who are elders. It was sort of a helpful thing for me to begin to get a benchmark or idea of how many, you know, people or who it was, or just sort of the sheer numbers in this population. Now, I want to talk specifically about, we're talking about whether or not the bereavement experience might be different for people who identify as LGBT, lesbian, gay, bisexual, or transgender. And the truth is, in working with a number of bereaved individuals over the years, I really believe that the grief process is an individual journey for each person who's experiencing a loss or losses. But in putting together this presentation, it's really to talk about different themes that have come up in working with this particular population, how things might be different, or what we as providers or individuals who are in elders' life and people also across the age spectrum may want to consider when sitting with people who identify as LGBT who have lost someone. So in thinking about an elder population, because that was initially who, Lisa's example when she talked about the man who had a long-term partnership and was unable to talk about his partner experience within the bereavement group, as long as he didn't talk about the nature of the relationship. We initially, I think, when first talking about this grant, we're thinking about people coming to talk about partner loss or spousal loss. And so we're particularly thinking of an elder population, although our groups are open to people of all ages. So I will be talking about other age cohorts a bit as well, but mostly focusing on elders. When we think about who are, I should give a numeric example, but when you think of who are LGBT elders in general, or what might be some of the things that differentiate this population from their heterosexual counterparts, I think that there are a few things that have come up repeatedly across the research. First of all, LGBT elders are more likely to be caregivers to friends and partners than their heterosexual counterparts. It's part of what I'll talk about is looking at this population's social support networks and how friends, same-age peers, there's often, sort of the chosen family becomes a significant part of and place of support in individuals' lives because particularly the older the population, there may be an increased chance of cutoff from family. Certainly over time, homosexuality in general has been much more widely accepted in broader society, but that doesn't mean that in the older segment of our society has experienced that kind of change within their age cohort. In one survey, as on the slide of, and I draw from the survey a lot, there's a reference on the next slide to the study of 2,560 LGBT elders that were selected nationwide in both rural and urban settings. 31% of participants had household incomes at or below the poverty level. Another thing that's of significance, I said, some people are working for various institutions. LGBT elders are more likely than their heterosexual counterparts to have contact with a formal care system. They're more likely to live alone or also to be involved in care at some level. One other thing, I'm just going to go back to the previous slide for 1 second. Sorry, because I didn't say this. So besides the poverty, slightly more than half of participants have been told by a doctor that they have had depression, and nearly 1/4 were told by a doctor that they have anxiety. And so there can be potential mental health risks that seem to be higher in comparison studies than heterosexual populations. And this is, I think, largely due to the presence of homophobia in society. The experience of perceived discrimination and actual discrimination has had profound long-term effects on all different kinds of health indicators, and one of them being mental health. It has a mental health impact. in that same study, many people talked about having had the experience of having experienced physical assault, had definitely experienced bias in a range of social service, health, and other kinds of settings. Our groups are funded on a suicide prevention grant, and in that same study, 39%, which we use a lot because it's really the best benchmark, the best research that's been done, that looked at a range of domains and also was able to get nationwide sampling and a very large sample size. So of those 2,560 participants, 39% talked about how they'd seriously thought of suicide at some point, and that of that 39%, about 40 directly related that to their sexual orientation or gender identity. And more than half also talked about loneliness. One of the things that the LGBT Aging Project does, and perhaps Thea and Lisa can talk about it a little bit more, is that they have a congregate meal program where they've been able to get funding to have just community-based meals for LGBT seniors, and how for many people this might be just the foundation of their social experiences for the week, or it's where they've been able to develop a different kind of social support network. As many people, I know from my bereavement groups over the years, may have found a partner and sort of just kind of live behind a picket fence, or like to really kind of live a private life within a long-term partnership. And although the LGBT aspect of their identity was always significant in a private way, that might not have been something that had been previously experienced. I'm just going to take it back to one slide to just briefly talk about the context of the work that we've been doing. Has been grant funded. It's been through the Massachusetts Department of Public Health, and that we have been, since 2009, offering 6 to 8-week groups held all across the Commonwealth of Massachusetts that are free to LGBT identified participants of any age. There is someone who specifically does outreach and who has really, I think sometimes finding participants can be difficult. I'll talk about that a little bit with some of the internalized homophobia. And we've also met at a different, in a range of locations over time, in a church, senior centers, public libraries, so that people would feel comfortable coming into our groups. Anyway, and please type in, this is new technology to me, and I feel like I'm just adjusting to the point that I can't see, and all of you who are listening, if there are questions that come up as I speak, or if you have any concerns or anything else that you'd like, please feel free to use the chat box in the lower left-hand corner of your screen, and to just direct it to the chairperson, and I will see your question as it comes up. So in thinking about this group specifically, and with a historical context, which I'll talk about a little bit more in a bit, we really, as we entered into doing these types with others, I really wanted to try to take away from approaching doing a therapeutic intervention in a way that sort of would think heavily on pathology. I'll talk about it a bit more later, but for example, within the mental health field, the Diagnostic and Statistical Manual is used to come up with a range of diagnoses, which often will help people get access to services for mental health care, as I'm sure many of you know. But what I have found remarkable is that the diagnosis of homosexuality as being enough to determine someone's level of mental unfitness wasn't removed until 1974, which is one of the reasons why we thought a lot about gearing this and thinking particularly about elders as we put together these groups. First of all, most people who experience loss tend to be over the age of 60 in this country because that's really when people's peer networks are getting more. Those are the folks who experience the greatest amount of loss. And secondly, if thinking about elders, I think that we could look at a lot of ideas around the concepts of disenfranchised grief in a careful way, and then design a group that would be, would hopefully, be empowering and supportive to all members of the LGBT community, as well as certainly, I think, the heterosexual community as well around issues of loss. But with that DSM removal of the diagnosis of homosexuality in 1974, I think looking at key dates can be something that's really important as we think about the impact of homosexuality in people's lives. For example, I feel I identify as lesbian and was born in 1970, and so I really haven't had, while I've experienced or understand, homophobia, internalized homophobia in a certain kind of cultural context, it's very different for me than for someone who was born in 1930 or even 1950. For the person born in 1930, homosexuality wasn't removed until they were 44 years of age, whereas 1950, 24 years of age. I often tell the story of how I've had arguments over the years with my stepfather, who happened to be born in 1930. He's a highly educated man, was a university president, but still on occasion will conflate the two words homosexuality and pedophilia, which are two words with very different meanings. It was helpful for me to learn that homosexuality and pedophilia were right there together in the DSM, that those ideas weren't separate. They weren't formally separated within the manual that guides my field's way of thinking until 1974. And so my stepfather, who's heterosexual, as well as many of the elders that I work with, sometimes do put those two ideas together because that was sort of what was a broader cultural idea. I've talked to gay male elders who say that while they've never had, for example, any attraction to young males, it's an idea that they had to fight off internally, or a bias that they had towards other same-age gay men, just because of the just predominance of the connection of those two words in society at large. And I think that kind of way of thinking and thinking about that deep level of pathology about someone's sexual orientation is really helpful in thinking about how to do any kind of therapeutic intervention or engagement with a group of LGBT elders, because what they have lived through over the arc or trajectory of history really influences how they think about mental health, whether they would have any trust in mental health providers, how they interact or engage with institutions and other ways. And so when putting together these bereavement groups, it was really vital for me to make sure that from the initial screening conversations that I had with people, that people had a sense that there wasn't a right way to grieve, that there's not a preferred end goal or process. I think that for all people that I've worked with who are experiencing bereavement, there are different moments along the way where people wonder, is my experience normal? This is heterosexual people, homosexual people, that there just are ways that because we don't talk about grief very well in our society at large, there's not a lot of space for those kinds of conversations when people are still feeling just very bereft, or when people are experiencing fearfulness at different times. They can feel like, am I normal? Is this normal or not? And for so many people within the LGBT community who may have even less of an audience than some others to talk about their losses, I really wanted to make sure that there was a just clear communication from the get-go and throughout pretty much every group about how there isn't a right way to do this or an expected time frame, that people really are on an individual journey when it comes to loss. Also, the beliefs and practices around loss are located within social or cultural discourses. So certainly I can ask people, what's, an expected time that someone might experience, symptoms or experience a high level of grief. And so often people will say something like, oh, about a year. And this idea of a year within U.S. culture certainly is connected to various practices of, various religious practices, cultural ideas or norms about grief. Certainly, Elizabeth Kubler-Ross's ideas of stages of grief have become very embedded in how we think about loss. Her ideas, which some have contested over the years, about people moving through various stages, current feelings as they respond to a loss, have become an expectation for people about this is the normal way, this is how people go through loss. I should feel the anger, I should feel denial, I should feel this, that, or the other. And if I'm not feeling that, if I'm just feeling this way right now, am I doing it right? So also one of the things that we talk about in the groups is that, I'm not going to be the one as the therapist or as the person who's providing the service to talk about whether or not something's problematic in the way someone's responding to a loss. Something's only problematic if that individual is finding it to be problematic, that they are having trouble focusing at work, that they are feeling surges of feeling in a time that makes them feel uncomfortable or like they can't be out in the world in the same way. I understand grief to be a pretty disorienting process, or the process of bereavement to be pretty disorienting, that people have to sort of, kind of reorganize themselves in relation to the loss. But I don't really think that no matter how acute a person may be experiencing a particular feeling, I don't see that often as problematic unless the person identifies it as so. And another thing that we talk a lot about, and I'll move into disenfranchised grief in a little bit, and this is an idea that I think is connected to that, is that when a person loses someone in their life, they both lose the person themselves, but also hopes and dreams that were connected with that person and how they understood themselves within the context of the relationship. So really that if we come to know who we are through another person's eyes, I often will ask people to think about a quality that they value about themselves or something that you know to be true about yourself for just a minute. And then if you think about, well, how did I come to the conclusion that I'm a good person or that I'm kind or that I'm a smart person, whatever one would come up with, that has come to you through a relationship with another person. And so I think so often what's lost is the ways that people uniquely knew you. When people are coming to talk about the loss of a partner, what were the things that person appreciated about them or knew, the ways that they knew them that no one else in the world ever has known them? What was it that made that connection special or magical? Part of it was who that other person was, but part of it was how a person felt in relation to their partner or their parents or, a sibling. So that's one of the things in terms of just an overview of what I do when I coach the work. So, one of the things that start with the screening, but also so I do an initial call before anyone comes into the group, which is the same that someone would do in a casual conversation, probably with someone discussing a loss or in an individual type of treatment setting, is to try to assess and come up to the ways that, that loss is unique for that person. Now, again, this is a conversation that would be had with anybody, regardless of their sexual orientation. But I do feel like when I know that someone is LGBT, I also think about some of these pieces of information in a different kind of way. So, first of all, I'm thinking about what is someone's relationship to the deceased. One of the things that I have learned and heard repeatedly over the years is how this relationship has also been influenced by How sexual orientation might play into that would be people probably have a understanding of partner loss. Not everyone might see it as equivalent to heterosexual partner loss or others, but I think that that's changing tremendously. So, in broader society as gay marriage is legalized in more places. But I think that also within the LGBT community, friendships might also be more considered to be like family relationships in a different kind of way than some heterosexual friendships that so often people talk about, and particularly, I see this happening with elders. There might be some differences about, friends are families. And so I've had participants in the bereavement groups who said, well, it's not like I would be talking about that I'm a gay man or that I'm a lesbian woman in a regular bereavement group when I was talking about a friend loss, but people just didn't understand that person was far more than my friend. They were a family member to me, and that relationship wasn't as acknowledged. And it's so often it's the idea of a chosen family being made up of friends or other people in your life has come out from a history of someone perhaps having a cutoff from their family when they came out, and so that friends then become the replacement family for some people. And that connects a bit to social support. But also, I think that, the broader recognition or acknowledgement of the relationship, even if people are talking about a partnership where their partner has died after, 35 years of them being together, I've been surprised as I've worked with older LGBT individuals, how, whereas I at 40 might be out to my tax preparer or dental hygienist, that many people who work through different years wouldn't have that degree of being out. And so they may have also worked at the same place for 30 years, but no one at work knows them to have a partner, which makes it complicated when you're going in and you have just lost the love of your life and you can't talk about it, or that it's rendered invisible in a setting where you're spending the majority of your time. And the same thing might be true with neighbors or with other contexts. There's someone who just talk about this. So, I've heard so many stories that have been heartbreaking for me to listen to in terms of, people in a long-term partnership who were so careful to never touch each other in public, to never go to a gay pride because they didn't want to be seen. What if they were photographed there? But even if they recognized that times were changing, just feeling at high risk, or that they had lived through different time periods, so they knew that things could also change back. To not have different kinds of trust in institutions, going back to the idea of that more LGBT elders are caregivers. So many people talk about not wanting to have care providers into their home, not necessarily bringing their partner with them to doctor's appointments, not even acknowledging that they're in relationship in a number of settings because of being feared of being seen in relationship to another person. And dramatic stories like someone talked to me about two women who were together for about 40 years, and one of them fell and broke a hip and needed to spend time in rehab. And she told her partner, from whom she had not spent a night apart in 4 decades, please don't come in and see me every day. You can call, one time a day, but and you can come in 1 time per week, but bring a friend with you, because if anyone here knows that I'm a lesbian, I'm completely dependent on others in terms of, taking me to the bathroom, in terms of helping me, physically move around. And if people discover I'm a lesbian, I might not be taken care of as well, or I might be at risk in some way. And so many elders may recloset themselves as they interface with institutions due to a long history in their lived life of formalized institutional discrimination. I used the example of the DSM, but people could be hospitalized long-term against their will simply for being homosexual. And so one can understand how there could be fear relating to any kind of health institution. Other factors, age, gender, finances, a history of relationships to formal institutions and services. A lot of elders or others may not want to come out, although now with Don't Ask, Don't Tell changing, culturally there's change, but there's a lot of LGBT elders who have served in the military who may feel that their benefits would be at risk if they were to come out. And so, they may not be connected to other settings like churches or religious institutions of any kind because of having received messages of non-acceptance from such places at other times. And so there may be a different degree of isolation to broader social supports, institutional supports, as well as to friendships or other things, other types of more informal connections. All this connects with an idea that was originally put forward by the bereavement theorist Kenneth Doka on disenfranchised grief, and this definition is sort of what it stated in terms of any grief that's unacknowledged or unrecognized by members of society can be described as disenfranchised. So if you think that it's hard enough for people to, if anyone has experienced a loss, that you realize that your circle becomes much smaller, and to you might have like a true conversation of one's emotional experiences in relation to loss. I think that there are a range of losses, such as by suicide or homicide or other kinds of ways that people have died, for example, that make it harder to have socially sanctioned conversations. If people in general are unsure what to say to someone who's gone through a loss, it becomes that much harder for someone to say anything, both to talk about what someone's experienced or to have a response by others when it's a loss that, it's just there's less social sanction to talk about those kinds of conversations. Many folks participating in groups talk about how speaking about same-sex partner relationships would fit into this category, even though, again, that socially things are changing, and as a result, people who are younger might find an audience that would recognize the significance of a loss with a same-sex partner, would see it the same as a heterosexual spousal or partner loss. That isn't true in all communities or among all age cohorts. Often the older people are, the less likely they are to find that kind of support within their age cohort, simply because of when, that era of what homosexuality has been over time. I'm sort of coming to these rash conclusions based on conversations with people. Disenfranchised grievers might suffer from feelings of alienation or shame in addition to their grief, that sense of internalized homophobia. They also might experience amplified physical and emotional symptoms of grief. That if there's not a place to talk about your feelings, if there's not an audience for you to bring your experience to, oftentimes then they might be expressed somatically. Someone might begin to have more health symptoms or other kinds of problems. Overall, it's not unusual. I think people in long-term partnerships, partners often at risk of, it's a greater risk of death themselves in the first year post-loss, just because of adjusting to life alone after loss of partnership, and that studies across the UK and the US have showed that with even less of an audience to talk about loss, homosexual folks, people who have experienced same-sex partner loss might be more likely to have greater, you have greater risk of having physical, emotional, other kinds of both how they experience it, but also health experiences that put them at risk in some ways. So, okay. Using a bit, and I talked about the next slide a little bit, about homophobia across the lifespan. It just gives some different comparative ages of when someone was born in 1946 versus 66, of how old a person was. If these are sort of key markers indicating social change over time. First public elected figure. They would have been someone who was born in 1946. No one, the first time the president mentioned the word AIDS or HIV was not until they were 41. And that would be someone also who would have likely been losing a tremendous amount of their community at that time to HIV. For all of us, so often when we experience a loss, it might connect us to other histories of loss in our lives. And I think particularly when I work with gay men of a certain age, any loss that's in the present is also connected to a very significant history of many losses they've experienced. There was a participant in a group a couple of years ago who came not for a recent loss, but because when they came out as a teenager, their family put them on the street. And he survived through connecting with other young gay men his age and sort of had a community of 19 men who became each other's family. Other people who had family disconnect or had to make it on their own at a young age. And he was the only person who was HIV positive, but he was the only person out of those 19 men who were his family, who sort of helped him survive through a period of tremendous vulnerability and homelessness and just, his adjustment as he was coming into being as a gay man as he knew it. He was the only one of the 19 who survived. All 18 others died of HIV AIDS. And it was something that both the survival guilt, but also just weathering all of that loss, even if it had happened over a decade ago, was something that he carried with him into any relationship, any friendship that presented itself. It completely changed his relational world in terms of his trust or his willingness to be close to anyone else. So I do feel like knowing a bit about history, and particularly maybe LGBT history, or thinking about key markers can be something that's helpful in speaking to people over time. The next piece is how perceptions of homophobia impact whether or not individuals access available services. As I sort of referenced before, many people may not have trust in different kinds of institutions because of a history with these institutions. So they may not be open to going to a bereavement group that's affiliated with maybe with a hospital or with hospice services. They may feel very wary of having people come into their homes to provide home care. Lots of people who were caregivers who were talking about partner loss over the years talked about how retrospectively they probably waited too long to get help for their beloved because of that person's distrust and getting help from anyone else, their unwillingness as a couple to have anyone come into their lives or into their home, and how, just through that horrible after post-loss guilt of, maybe I should have done something differently. And people really having to reconcile with the role of homophobia in their lives and their partnership and how it might have impacted their willingness to get services in the past. I know, for example, I do a lot of different kinds of clinical work, and, very rarely do I come out to people that I work with. However, I find that in doing these groups, that's so often something that people want to know right away from me. In the group, or like, will everyone in the group identify as LGBT? Do you? These questions tend to come up a lot more in relation to doing LGBT-specific groups. Now, that doesn't mean that I don't think a heterosexual individual could do the group, just as well. It's not better. I think sometimes when we identify, have similarities with other people, we might think that we understand more of their experiences than we do. But I do feel like somehow it's important to communicate in doing work with others that we have an understanding or a context or a way, that we might be able to ask particular kinds of questions that would help them understand that we will see or understand parts of their experience, whether that be, understanding that a friendship would have a different level of significance, possibly, that it may be as significant as a family member, that, other different kinds of contexts, not assuming that someone is out to everyone in their lives, for example, just to always think about what our assumptions are in relation to others. So we can go into the next slide, please. I'm going to do that. So in putting together a group, so understanding the LGBT experiences of grief. So what research has shown is that in different kinds of needs assessment surveys, LGBT elders have said that there is a real need for more people to be doing LGBT-specific bereavement groups, or to at least increase the level of education to understand their experiences more. And something that's come up in 3 needs surveys that I can think of in looking at the literature. And so how does that play out is that there might be a lack of assessment questions by providers to acknowledge losses in the first place, I think it's so often the questions around how we assess the individuals that we work with really then have so many broader, if we don't ask a question, we're not going to have information that might be useful. Not everyone's going to come out to us right away. In fact, it may take a lot of time, but even to be able to ask a question of, a little bit about someone's, even if we ask a question on how someone might identify in terms of their sexual orientation, or to inquire if they talk about a loss, whether or not that person was a partner, a friend, how they would describe what words they would use to describe the relationship. I think it's open-ended as we can leave. Our questions, might invite people to step in and tell us a bit more about who they are. Similarly, a lack of knowledge about LGBT history or culture to understand significance or context of various losses, or how people might be responding to them. How I have really realized over time that, to really find out, for example, how many people knew that you and so were a couple, it's just so informative, because if there's really only, like their partner's sister is the person who really knew that they were a couple, and several friends, it already reduces an audience who can potentially hear about that person's pain and losing their same-sex partner. It might bring it down to 3 or 4 people when they're at work every day, when they can't talk to their boss about how they're a bit distracted right now because they lost their partner of several decades. I think that for me, follow-up questions are really critical to make sure that I understand this kind of context. I've spoken a lot about same-sex partnerships, and particularly in thinking about LGBT elders. I also feel like, there's, in doing these groups, we've worked with people of all ages, and it's just been interesting to see themes that come up related to sexual orientation or identity to different other kinds of losses. So often in hearing about someone who's lost a parent, hearing not only the grief in that loss, and so maybe, but sometimes if you look at the caretaking history or the management of the estate or different kinds of things related to loss within a family context, I've often, it's a regular thing that comes up with people is that their siblings, when it came time to doing some caretaking, taking a leave from work or something else, their siblings assumed that they could do it because maybe they just had their partner, and and the other heterosexual siblings were married with children, and so it was less of a disruption for the gay or lesbian sibling to do the parental care when that may or may not be the case, but that was sort of the assumption and the pressure that a sibling was placed with, experienced. So it doesn't need to just be around partner loss for different things to come up around, about heterosexual identity or homosexual identity. So I'm doing a lot of talking. Please feel free, again, to come up with any questions as we go along. Okay, it's hard not to see all of you. One of the things, too, that if people have less of an audience to talk about their experience of loss or how they're moving through something, it's very easy then to realize, well, look at the man who had lost 19 people. Why, it's been over a decade. Like, is there something wrong with him? Like, why wouldn't he, talk about it? Or why is he still experiencing this grief? Well, he's lost everyone in his family. He feels quite alone, and he has not had a lot of trust around any kind of institutions or going to mental health services or other kinds of things because of some of the experiences that he had over the years. How that it was only because everyone else in the group was going to be identified as LGBT that he felt comfortable enough to begin to put voice to his experience. He felt that other people in the group would understand the significance of friendships, that they might understand why he didn't have trust in talking to other people about it, because of the homophobia that he had experienced in his primary relationships. He was completely cut off from his family at age, 14. So why would he come forward and talk to someone who might similarly reject him? So thinking about mutual treatment concepts, which is the next slide, slide 14. We talked a bit about this disenfranchised grief idea by Kenneth Doka. So to really think about the impact of stigma on the acknowledgement or expressions of and healing from losses. This is why a lot of hospice groups might do, groups are like Samaritans do groups around loss specifically related to suicide. How important it is when there hasn't been an audience to create an audience to help to diminish that sense of stigma, to create an audience that will have understandings of the particularities of experience. I think that whereas some, certainly many communities or places can't do an LGBT-specific group or might not find enough individuals, the idea that one might be offered or that it could be different has been something that has brought many people into bereavement groups that wouldn't otherwise be there. Also, it's not uncommon in my groups that people are actively having suicidal ideation that talk about because of the loneliness, because of the isolation that they feel post-loss, because they haven't had anyone to talk to, it's something that they are spending more time engaged in that kind of thinking. I found that more postmodern therapies, such as narrative therapy or other collaborative therapies that really recognize the role of the client being the experts in the room. Helps in terms of an empowerment approach. Also, I think that postmodern therapies tend to understand the role of, identity is being shaped through other people's eyes, that it's something that's relationally created. And as a result, I think that can be a helpful understanding to bring into a bereavement group. Group therapy in and of itself, after someone has gone through some initial, potentially individual work or has had some initial support, is a wonderful way to diminish the sense of isolation and of stigma. I just think that bereavement groups are such a common group. Many people do therapeutic work within a group context as opposed to individual context because there's so much that people can learn from each other, and I think it just takes away from the isolation of experience that so many people have post-loss. Just repeatedly people will talk about how nice it is to have a set time and place and to meet people that they might not meet in any other context or way as they went through the world, and yet that there's so much commonality of experience around loss. I think that in approaching bereaved individuals, whether in individual work or in group context, really challenging and paying attention to any ideas that I have about what normal loss looks like and what might not be normal, and to really think about if they begin to think about pathology or maybe something's not normal in someone, to make sure that I'm accounting for all the different kinds of experiences of marginalization or discrimination or life context that a person would have prior to joining the group. And lastly, the recognition of significance or formal help-seeking behavior due to a history of oppression, institutions and systems is so key. It's hard to reach out for help under any kind of situation. I think that for those who have recently experienced loss, there's often a particular vulnerability, and for people who have had sort of formalized institutional discrimination, I think that coming forward and asking for help from institutions is something that shouldn't be minimized in any way. And just even when I appreciate people reaching out and talking about what steps it might have taken to have them get there, just how that's a really nice, wonderful connection in the beginning. Now, we have just under 15 minutes left, and I'm happy to talk a little bit about some of the things that I do in group, or if you have any particular questions about what you've heard thus far, I'd be happy to answer those. But I would love to have a little bit of connection to folks who might be listening, just so I know what might be useful to you at this time. Or Lisa or Brandy, if you have anything as well.
Oh, no, I think we'll just wait a bit and see if any questions come in. Again, if you have any questions, please use the chat function so that we can see your questions. So, Beth, I guess we can just wait a minute, and then if you want to speak particularly about some of your experiences with some of the groups, then we can do that and then end accordingly.
Okay. One of the things, Lisa, that I would be interested in hearing about a bit from you maybe is, I think so often people who work for various organizations can talk about how hard it can be to find members of the LGBT community, and I know that the Aging Project has done a lot with partnerships, has done a lot with training, and I wondered if you might have any ideas that might be salient on the subject to that.
Yeah, I think that one of the things that has been important to us and challenging is how do we reach folks who are isolated and who are carrying, the sense of grief that they need and would really benefit from these connections. And so we will advertise in Bay Windows, which is a local LGBT press, about groups that are taking place. Most of the groups that we've run, we've done in conjunction with mainstream elder service providers who may have participated in some of our education and training and want to be reaching out to this community, or folks who are really trying to sort of make these kinds of connections. And so getting the word out both in, it might be the local community newspaper, it might be the LGBT community newspaper, through elder services, through word of mouth, are all the ways that we really try to make sure that we're reaching the people who need us most. One of the things that I have also seen that's come up around the bereavement issues when we've even advertised the group is, and you've been talking really nicely about all the issues around loss of relationships. So the couple things that have come up that people have inquired about that are sort of fall outside of the usual realm for what we think of for bereavement group is that we have had some inquiries from folks around loss of their pets. And that particularly in the LGBT community, where many people and many of this generation don't necessarily have children, that their primary relationship and the primary life companion may be an animal. And our larger culture has an issue about recognizing those relationships, and I think particularly in the LGBT community that can be really quite significant for folks. The other thing that we have heard around inquiries have been around grief around life experience and grief about a lifetime of missed opportunity, around having been, sort of that internalized sense of homophobia and look at what I missed out on, or I lived such a closeted life, or I wasn't able to connect with people in an authentic way. And people we did have someone who called and said, I really want to be in this bereavement group. And when he was asked, who are you grieving, he said, myself. And so this was somebody who I think has been HIV positive for many years and sort of lived in a sense of limbo. And so those are some of the other requests that we're hearing from folks in the community when they are sort of interpreting what grief means to them and what loss means as well.
So, Beth, I don't see any questions. I don't know if you have any concluding comments or thoughts as we are approaching 3:30 now.
Okay. Well, I guess I really tried to focus on some of the differences that an LGBT individual might face, try to talk about some themes around loss. I teach in schools of social work, and as a practice instructor, I really always like to sort of try to give people skills or tools or different kinds of ideas. And I think that in general, one of the things that can come up or that was really useful around loss, and I think this would be true in any kind of bereavement group or conversations around loss, is it's just one of the favorite groups that people have is when they bring in photographs of the person that they've lost or the people that they've lost, and how having an image that can be passed around is really a wonderful way to start as a catalyst for telling stories. Oftentimes, why this picture as opposed to others, unlocks other different kinds of things or particular memories. These kinds of tangibles of holding on to a picture, one can also ask the questions of, so this idea of how we understand ourselves is through another person's eyes. I like to spend a lot of time, really having extended conversations with people about what was it that person knew about you, that maybe no one else did, or, what was it that they appreciated about you that felt so special? I think that can also help in terms of helping people to find or to think about other relationships where there might be that same or similar kind of acknowledgement. But there's something about the photographs which also makes relationships that have so often been rendered invisible quite visible. Photographs of someone with their partner, photographs of that are quite dear to people's hearts that I think are a wonderful thing that people can do in any kind of context. So often what people are eager for is an audience for their stories. And so whether one works at a senior center and are having more informal conversations with people or are doing some kind of explicit therapy, I think that really inviting people into the detailed specifics around loss, their life, even just saying what was the person's name, using the person's name. People say, no one in my life says his name, her name anymore. How nice that is. Anyway, I do feel like these kinds of interventions are important. There's a question that has come in about, do we have a flyer, a brochure about the groups? It'd be helpful on many levels to place them in medical practice along with other flyers. And so, Lisa, you wanted to answer that one?
Sure, yes. So we do have some materials and have sent things out through email to lots of medical practices and to hospitals and hospice and a variety of resources as well, but can continue to send those out. And if anyone's interested in getting some, my contact information I think is up on the slide, and we're happy to send some of that out to folks as well, because I think that any and all of the participants who can hold on to our materials and let us know when they have folks who might be a good referral would be great. We schedule the groups. We don't have a set schedule so that we can't say, oh yes, right now we have a group that is starting in this location at this time. We try and take a look at where there's some demand, and also take a look at availability, but do want to make sure that we are getting the groups out there for folks as they need them. So if you know folks, please do refer them to us. And even if we don't have a group that's going to start up right away, we will continue to engage with folks as we are getting our time and place and location set up for them.
Great. I just appreciate everyone's attendance or participation today to learn more about this or to just be involved. So if anyone else has a final question, I'd be happy to, one of us can answer that. Or
yeah, I think, Beth, I'll just go ahead and piggyback off of what you're saying. I want to thank Beth, you and Lisa for presenting today. I want to thank all the participants still remaining on our call. And I don't know if I said this earlier, but I will be emailing everyone who participated this afternoon. I'll be emailing you the slides as well as sending you the link for the podcast for our webinar, since we did record it today. After you log off, please take a few minutes and just complete the survey, as we definitely value your feedback, not only for this webinar, but for other webinars that you may want to have in the future. Again, I thank you for participating, and I hope you've gained a little bit more knowledge about some of the risk factors, experiences, challenges, and the needs of lesbian, gay, bisexual, and transgender elders as they grieve the loss of a loved one. Again, thank you, Lisa. Thank you, Beth. Thank you, everyone, for participating, and have a wonderful day.
Thanks so much for having us and for hosting this, Brandy.
yes, yes.
Thank you again. Bye, everyone.
Bye-bye.
Bye.
Thank you. Please stand by.